Okay, ladies and gentlemen, boys and girls, if we can settle down and start this next lunchtime session, Your Conscience, My Health, the Right to Refuse. And this is really a discussion that is extremely topical at the moment on looking at the whole issue of conscientious objection and whether or not doctors should have the right to be able to back off and take themselves out of carrying out certain kinds of clinical practice. It's one thing that's very live for me. My name's Furedi. I run British Pregnancy Advisory Service. And clearly we're a service that's providing abortion contraception services. There are issues for us about doctors opting out of training. There are issues that I have to contend with within our service, where doctors may feel comfortable about operating up to a certain gestation for abortion, but not going beyond that. And there's no doubt at all that people have very strong views, in the same way that women may have very strong views about their right to treatment. So doctors will have their own views about how they fit and whether they feel able to provide those kinds of treatments. So I'm going to introduce to you three speakers. First of all, Dr. Christian Fiala, who's been a colleague of mine for a very long time. He runs an abortion service in Austria, has been very involved in debates on this issue. He also works internationally for FIAPAC, the International Federation of Abortion and Contraceptive Providers, which has just organised a conference of about 600 people where this issue was particularly discussed. So Christian's going to speak first. John Wyatt, on my left, is a professor of ethics and perinatology and a consultant neonatologist at University College London. He's a veteran of the battle of ideas, and John and I have debated many times on issues around abortion, where we usually kind of varying views, but I think generally feel that we've got a lot to talk about, and there's quite a rich discourse in this. And David Nolan is Director of Communications for Catholics for Choice, which is also an organisation that we've had a lot to do with over the years, being an organisation that's really looking at how those within the Catholic Church can balance a commitment to women's reproductive rights and freedom. So we've got three quite fast introductory talks. I'm then going to throw it open to you for questions, and then we'll have a wrap-up session to try and resolve some of the answers. So Christian's going to go first. Christian.
Thank you very much for this kind introduction. Actually, I would like to give you a brief overview on the topic. And I think before we enter in a discussion, and most people have a particular view on the topic, but before we enter a discussion, it is important to outline some basic considerations, and this is what I will go through: the origin of the term conscientious objection in reproductive health, comparing it to military service, and a conclusion. Now, the origin of the term of conscientious objection, I think that is really crucial that we keep that in mind. The origin is religiously founded objection to participate in a war situation. So it is a religious conviction to refuse killing people in a military service. And you find two definitions, and the lower definition is from the US Department of Defense. So that's the origin of the term, why we talk on conscientious objection. So consequently, there are different legal resolutions. This one is from the European Council, again, where the European Council is very strongly confirming the right of individuals to object conscription for military and to participate in a war situation out of various religious, ethical, moral, whatever reasons. And it's very interesting to compare the definition of conscientious objection in different languages. Below you find the German term, and in the German term, the war situation, a refusal to participate in war, is integrated in the term. So in some ways, the German expression is more precise because it's really refusal to participate in a war situation. And although objectors take their position on different views and beliefs, they all refuse to participate in a war situation. Now, how is conscientious objection in reproductive health, and what is the impact of it? How does that transfer in reproductive health? The situation is totally different in reproductive health. In reproductive health, it is the refusal of a healthcare provider to offer a legal medical service or treatment. And this refusal, it may be individual, but it is frequently institutional, regional, or sometimes whole countries. And women have no access to certain treatments in whole countries. So it's much more than just an individual decision. And I think there is a fundamental misunderstanding in this debate on conscientious objection in reproductive health. Because this debate is focusing mainly on abortion and also on emergency pill. And the fundamental misunderstanding is that women don't contact a doctor to get advice or judgment or counseling. They contact a doctor because they need a medical service. They need a treatment which they cannot do on themselves safely. Otherwise, if they could do it themselves, if it would be just to take an aspirin, they would not bother to see a doctor. They need a doctor, and because doctors have a monopoly over medical treatments, we shouldn't forget that. So women have no option to go somewhere else. They are dependent on this medical service. So doctors or healthcare professionals are rendering a service, just like other professionals. And what is it about? And these are ultrasound pictures. I'm sorry if you can't see them very nicely. This is a pregnancy at 6 weeks gestation. You see the gestation sac after the pregnancy, and this is how it looks like in the uterus. There is no cardiac activity, and if a doctor sees that picture, you cannot make the difference between an evolving pregnancy or a missed abortion. So it is indistinguishable. To refuse treatment on this patient is not kind of evidence-based. You cannot decide as a doctor, as a clinician, whether this is an evolving pregnancy or a miscarriage. And on the right side, sorry for the bad quality, you may see an embryo hole here of 1 centimeter, and the only distinction between a miscarriage and an evolving pregnancy is a small blip, which you would see there if it is a viable pregnancy, representing the contractions of a cardiac duct. So if frequently we are faced with miscarriages in clinical routine, if I would see such a picture without this blimp, I would say, okay, this is a miscarriage, I will do a curettage. Doctors who refuse treatment, they would say, oh no, there is a blimp representing contractions of a cardiac duct, I will refuse opt-out. And this has significant consequences on women. This is just an example from my country, home country, Salzburg. You may know Salzburg, Sound of Music and so on. But just to tell you, I have to travel together with some colleagues every single weekend. Today it's a colleague of mine who is doing from Vienna because all doctors in Salzburg County were forced to opt out. They were forced, and this is a citation from a director of one of the hospitals in Salzburg County where they say, where the director says, if any of my doctors would perform an abortion, he would have to go. So this is how conscientious objection is in reality. And this was on a regional level, now this is on a national level. This is a questionnaire done by the Italian government, and you can see that 70% of all doctors in Italy, they opt out. So this, what is called conscientious objection on an individual basis, is actually hampering, restricting women's access to legal treatment. This is a citation from South Africa. Again, the reality factor, although abortion is legal in Africa, South Africa, the reality is that most doctors would opt out, and as a net result, women have no access. Now, how come that we end up with conscientious objection as a refusal to treat on such a wide scale. I think it is because we are comparing conscientious objection from military service to reproductive health, and that is a serious mistake, because there is actually nothing we can compare it. But this is what especially religious people do, the Pope and others. They say because abortion is killing a human life, hence people and doctors should have the right to opt out. But killing a human being has nothing to do with terminating the development of an early pregnancy. It's really a totally different situation. Furthermore, soldiers, they are forced into in their profession. Their duty is to comply with military orders, and their activity is to conquer for financial or other benefits. Whereas as health professionals, we have a totally different environment to work in, and our ethical status is totally different. We are there to serve patients and offer a medical service which patients cannot get anywhere else. So the conclusion is we have to weigh the interest of the health professional versus the interest of the patient. But the health professional, he is bringing forward a personal, non-verifiable belief. He's holding a powerful position out of his own choice, and after successful competition, no one is forced to become a gynecologist. And treating women with an unwanted pregnancy is an integral part of obstetrics and gynecology, just as seeing blood is an integral part of a surgeon. You cannot, as a surgeon, opt out of doing surgeries because you can't see blood. The situation for a patient is totally different. You need this treatment, you are dependent on the service, and women didn't choose to be in the situation of an unwanted pregnancy. So, in conclusion, conscientious objection in reproductive health is a pretext for imposing one's personal beliefs on others. It is a refusal of legal and basic medical treatment, and this refusal represents an unethical abuse of a powerful position over a dependent patient. And refusing medical care or treatment based on conscientious objection, actually, if you think about, is equal to a mental inability to perform a duty. And it should be dealt equally. If someone can't count numbers, he should not become an accountant. And no one will force him, but a person cannot become accountant and then expect from others to take that into consideration. So, this is my last slide. As patients, and this concerns every one of you, we have to ask ourselves, what do we expect being treated by an evidence-based medicine within a legal framework, or by a faith-based medicine following religious rules? And if we accept faith-based medicine, then the question arises, why do we bother with producing evidence-based guidelines and evidence-based medicine if, after all, this can be overthrown by individual beliefs? Thank you very much for your attention.
Well, thank you very much, Christian, both for the presentation and for sticking to time. That was excellent and really posed some of the challenges that doctors opting out of service can present for women presenting for services. John.
Thanks very much. Well, thanks for the opportunity to talk and to share in this debate. It's easy to caricature this issue as a disagreement between, on the one hand, a bunch of balanced, objective, rational, liberal, benevolent and non-discriminatory people, doctors on the one hand, and on the other hand, a bunch of religious fanatics who are bigoted, irrational, hate-filled, discriminatory, and so on. But the truth is, this is a bizarre reconstruction of what is actually going on. The truth is, we live in a society in which we have profound disagreements about fundamental moral realities, about what it means to live a good life. And we have to find a way to live and work together which respects and tolerates those differences. The truth is, everybody is coming from somewhere. Everyone has fundamental moral beliefs and commitments. Polly Toynbee recently said, politics is all about a clash of moral universes. And it's not just politics. There's a sense in which medicine is also about a clash of moral universes. So, I want to put up front that I accept that the rights of conscientious objection in medicine have been abused on occasions. There have been cases when doctors have claimed the right to object when their real motivation was laziness, to avoid burdensome or boring duties, or blatant discrimination. But the fact that a right is capable of abuse doesn't mean that that right is illicit. I think the right of conscientious objection is not an absolute right, but it's an essential safeguard. This debate has much wider implications than a limited debate over abortion services and reproductive rights. The practice of medicine, the provision of healthcare, has always been seen as more than purely technical. It enshrines moral commitments and duties. It demands deep moral thought and personal integrity. It is not simply a question of being a technician, like an accountant, being able to count, click, word, click, there's the service. It doesn't work like that. And this idea of moral medicine is not something which is limited to religious believers alone. It's something that's binding on all doctors. Our first moral duty as a doctor is not to the state to carry out state-appointed activities. It's not to our employers. It's not to our own personal interests, our financial or whatever interests. Our overriding moral duty is to put the interests of our individual patients before anything else, and if necessary, to take the consequences. That is more than high-sounding verbal rhetoric and quasi-religious cant. It's actually the reality in the practice of medicine. And the attempt to prevent doctors from exercising conscientious objection is at root profoundly totalitarian and coercive. Because if it's not doctors who are given the right of deciding their own activities, then who is it? And the answer is ultimately it is the state. It's to say that the state will decide what treatments individual doctors will provide, and doctors will be forced by state power to comply. Have we airbrushed the last century from our memories? Have we forgotten what state power can do to medicine? In Stalin's Russia, quick history lesson, psychiatrists imprisoned, sedated, and electroshocked political dissidents because of state power. In Nazi Germany, well-known physicians performed barbaric medical experiments on prisoners. In Abu Ghraib and Guantanamo Bay, US military doctors have been actively involved in the supervision of torture. In the USA, physicians planned and carried out the infamous Tuskegee experiment in which hundreds of patients with advanced syphilis were deliberately deceived and left untreated. In China, doctors have been involved in preparing prisoners for execution, removing organs for transplant purposes. So we mustn't be naive in thinking that medical practice cannot become morally corrupted. In the end, history teaches us that when doctors are subject to coercion from state power or other sources, they act in ways which deny the fundamental moral values of good medicine. It's an essential safeguard for the moral health of medicine that legal and regulatory systems are maintained to protect the rights of doctors, to refuse to take part in practices which violate their most profound moral convictions. When you force me by state power to do something that is profoundly against my own moral convictions, you damage me, you destroy my own personal moral integrity. If you force me to torture somebody, if you force me to abuse somebody, if you force me to destroy the life that I'm committed to protect, then you damage me. It's interesting that British soldiers actually do have a right to conscientious objection. If they're given an order by a superior officer which violates their conscience, for instance to machine gun a group of innocent civilians, to engage in torture, then a British soldier has the right to disobey the order of a superior officer and to take the consequences. I don't know about you, but I find that extremely reassuring. What kind of soldier would you prefer? An individual moral agent with the right of conscience, or a mindless killing machine who just obeys orders? So when you go to see a doctor, what kind of person do you want? One of my jobs is teaching medical students ethics. And it's interesting that when I talk to medical students about ethics, and I try and talk about issues of morality and right and wrong, very often the question is, look, we don't want to know what's right and wrong. We just want to know what the rules are. Just tell me what the rules are. But I find that profoundly dangerous. I argue against it. It's one of the features of modern societies that we tend to collapse issues of morality, of right and wrong, into issues of rules. And I think we should oppose that, because ultimately these questions are moral. They're questions about a moral universe. Despite all the scandals, doctors and health professionals still retain high levels of trust in our society. And I think this stems in part from their reputation as independent caring professionals who have an open and stated duty to act with moral integrity in the best interests of their patients. If doctors are merely state apparatchiks, contracted, obliged to carry out the bidding of politicians, whatever the rules are, we do them, then why should we trust them to do the best for us? So I want to argue that the right of conscientious objection is a precious privilege which our law and professional guidelines currently protect. Like all privileges, it's open to abuse, and there's a grave danger that selfish, misguideless and thoughtless appeals to conscience may mean that that privilege is threatened and ultimately lost. The right of conscience is not absolute. Doctors have a duty to preserve the best interests of their patients, to keep them fully informed. The right must be balanced by genuine respect for the patient's concerns and interests. The GMC, for instance, says, you must treat your patients with respect, whatever their life choices and belief. You must not unfairly discriminate against them by allowing your personal views to affect adversely your professional relationship with them or the treatment you provide or arrange. So we must balance the right of conscientious objection with the rights of patients. And in particular, there's a duty to make sure that patients are fully informed about their rights to see another doctor. And similarly, doctors can't refuse to provide any care for a patient on the grounds that they've undergone or are about to undergo a procedure to which the doctor objects. Doctors still have a duty to act in the best interests of patients, and the GMC puts it like this: it's the procedure to which the doctor objects, not the patient. We still are there to act in the best interests of the patients, but we have the right to object to a particular procedure. So in summary, the right of conscience helps to preserve the moral integrity of the individual clinician. It preserves the distinctive characteristics and reputation of medicine as a profession. It acts as a safeguard against coercive state power. And it provides protection from discrimination with those with minority ethical beliefs. If we destroy the right of conscience, we will ultimately destroy the kind of society we all wish to belong to.
Okay, so this is all getting complicated and complex. David, take us through some of the rest.
Sure. Thank you very much, Anne, and thanks to the Institute of Ideas for inviting me to speak here. As Anne said, I'm the Director of Communications at Catholics for Choice, and I think I've been invited here to pick over some of the Catholic aspects of conscience, because that is something, conscience is something that's very inherent within Catholicism, and a lot of Catholic teaching is based on one's ability to exercise one's conscience. And perhaps because I'm the editor of a magazine called Conscience, and some part of me feels that at that stage I should just declare myself the winner of the argument because of that, and sit down. But I feel maybe I should try and justify my arguments. I found a lot to agree with in both the presentations that we heard earlier today, earlier just now, because conscience. It's something very internal. We just had a session about why is life sacred. And I think the thing that's important about conscience is that it is an inherently human thing. It is something that what the Church calls the most secret core and the sanctuary of the human person. It's your internal moral compass. It's you knowing what's right and what's wrong. And obviously, as such, it has some subjective and objective elements to it. Your own conscience is very much decided or informed by events outside of you, as well as John was saying about what you feel comfortable with yourself. As a federal judge in the United States said about something else, I know it when I see it. It is something you know what's right and what's wrong. I want to concentrate the rest of my remarks specifically on the abortion issue, because I work for an organization called Catholics for Choice, and that's what we do. While I recognize that it is very important in other elements, certainly in the United States, it is something that is almost exclusively discussed around health, reproductive health and rights issues. As Anne said, it's a very timely debate. You may, I'm sure most of you pay very close attention to what goes on at the Council of Europe, but for the couple of you who missed out, there was a big Donnybrook there a couple of weeks ago when Chris McCafferty introduced a resolution where she tried to regulate the issue of conscience, because she felt that there were a lot of organizations, specifically the Vatican and Catholic organizations, which were trying to impose conscience rights, not just on individuals, but also on institutions. I may have some arguments with how it was proposed, but the importance of the debate should not be ignored. And it's very unfortunate because of the importance of conscience to the anti-choice lobby, they organize their forces in a very dramatic manner, and while the resolution was passed, it was amended to within an inch of its life. And in fact, I think Chris McCafferty felt that it was amended beyond its useful life and became a tool for the anti-choice lobby. And I feel it's interesting to reflect on that, because the anti-choice lobby clearly has lost the debate in the hearts and souls of people. Certainly in Europe, the pro-choice position is in the ascendant, and I would argue also in the United States, even though the anti-choice lobby is very strong. But the anti-choice lobby have lost the hearts and souls. They've lost the debate in general, and they're forced to try and cut away at the edges of the provision of reproductive rights and abortion provision, because they can't do anything about the service itself. And it's important for the abortion issue as well, because abortion is unique. I have no qualms about saying that. I'm a very pro-choice individual, but abortion is different to almost any other medical procedure that I know, in that it does end a potential human life. And we can't shy away from that, because it would be dishonest to do so. That doesn't mean it's wrong, but it is a reality. But conscience and its abuse over the last decade and a half or so, it has become a political football. It has been battered around by those who feel that they are right, and either they're losing the debate or they want to cement the victory that they feel they have achieved, and they want to impose on others, not perhaps as dramatically as John was saying, but they do want to impose a limited conscience right. Because I do agree that there is a certain limited right of conscience to doctors. Because of the uniqueness of the abortion debate, I do think it is legitimate for individuals to opt out of providing the service. As Anne said, she herself has some doctors within her service who will not provide it beyond a certain gestation. But it is a really important and live debate. Just a couple of examples. In 2006 actually, but the debate started in 2005. The Slovakian government collapsed as a result of a fight over a conscience clause. I raised that particular one because after it happened, it was during a discussion around a concordat or agreement between the Vatican and the Slovakian Republic. After the government collapsed, the anti-choice lobbies singled out my organisation as having caused the collapse of the government. We didn't claim it, but we were quite happy to take the victory if that's what it was. But what the Vatican tried to do was impose its own particular view on conscience and a very restrictive conscience clause on all Slovakian hospitals. And anybody in any way involved in the provision of reproductive health services would be allowed to opt out, which would have resulted in no provision of contraception or family planning, let alone abortion or IVF treatments. And it's clear that that was a significant event in Slovakia, but it was just the start of a whole pile of battles that have been going on around Europe. We had a big discussion a couple of years ago here around St. John and St. Elizabeth's Hospital, where Cardinal Cormac Murphy O'Connor, who may also have some Irish blood in him, was imposed an ethics code on the hospital, saying that it was not allowed to refer or provide any abortions. As it happens, this was voted down, and the entire board resigned as a result of that. But it was a significant debate, and it was indicative of the importance that the anti-choice lobby places on the whole issue of conscience. And the reason I think this has got a particular Catholic angle to it, because as I said, conscience is a central part of the Catholic faith, but also because the Catholic bishops in the Vatican are the ones who are driving this. They are the ones who have turned it into a political football, and they are the ones who are going, not just in Europe, but in the United States and throughout Latin America, and certainly in the Philippines, where the Catholic hierarchy is very strong, and trying to impose the Vatican's own narrow understanding of its own teaching about conscience on the entire population, whether they're Catholic or not. And as in most countries, they most certainly are not. And what I want to conclude on is say that actually the Vatican's own interpretations of its teachings is wrong. It has a very unnuanced view of Catholic teaching And that's where organisations such as mine I feel play a very important role, because we can point out the fallacies in the Vatican's own argument. The Vatican argues in the Declaration of Religious Freedom, it is through his conscience that man sees and recognises the demands of divine law. He must not be forced to act contrary to his conscience. I apologise for the gender-exclusive language, but the Vatican is renowned for talking about humanity only as him and he. There's another part of it, though. While you may not be required to act contrary to your conscience, you must also take into account the consciences of other people. So a doctor facing a woman who wants to have an abortion must take into account the conscience of that woman. Whose conscience is the one who's going to take precedence here? This is a very important discussion, because while the medical professions may have a monopoly on the provision of healthcare, and therefore be allowed to provide or refuse services, it is very important that you recognise that, as I say, there's external elements of the whole issue of conscience, and you've got to take a woman's views into account. I'm finishing up now. So, I agree that it's because of the uniqueness of the abortion issue, I do think it's important that doctors should be allowed to opt out in non-extreme circumstances. I do not think, however, that an entire institution, let alone an entire country, may be allowed to opt out as a result of religious beliefs or ethical beliefs. I think that the provision of the service is what is the important thing, and it is important that any institution have mechanisms in place so that if individual doctors have announced that they will refuse to provide abortions, that they are required to refer a woman on to somebody else. I think, as I said at the beginning, conscience is an inherently human thing, so an institution cannot have one, despite what some people say. So I will conclude there. As I said, there's a lot more to go on, but conscience is a vital aspect of the medical profession, but it does not mean that one can deny services.
Okay, this is a tight session. It's really frustrating that we haven't got hours, so keep your comments quite short. Right at the back.
Yeah, I just wanted to say, right, my first port of call is you, I'll do it. And so I think that especially in an abortion situation, that leeway for a doctor shouldn't really be in his mind at all.
Okay, that's one view. Doctor as technician. Yeah. Ellie.
Thanks. It's a quick question, really, in response to John's comments, which by and large, unusually, when I've listened to John before, I really liked and found an awful lot in them, largely because in the current circumstances, my own sense of things in relation to the medical profession in general is to feel the need to defend the case for the special role of the medical profession, to defend its argument for claims to autonomy, for its ability to control its body of work against competition to that claim coming from a range of different sources. I mean, there's all sorts of different ways it's going on. I'm talking about this through mainly readings coming from sociology, so I've never been a doctor. But my understanding of it is that the basis for that type of claim, which I think is rightful, made by the medical profession, more strongly in the past than now, sadly, has also rested in large part on an understanding that the medical profession is special because it has special insight about the human body, and in contemporary terms we call that evidence-based medicine. So the reason why we should go with the idea that we should trust doctors, the reason why we should give them special privileges, the reason why we should allow doctors to do things to us that we wouldn't allow other people to do, for example, internal examinations, is because we believe they are doing the right thing and are acting in our interests, are altruistic, not self-interested, because they are practicing evidence-based medicine and they have special training and expertise and understanding of a body of knowledge which ordinary people don't have access to. So in the sociology of the thing, there has always been a very intimate connection posed between the ethics of the medical profession, its claim to special status, and evidence-based medicine. In your articulation of things, that connection broke down. So you seem to be making a claim for ethics and a way of doing something which is not necessarily expected, and that is to do with conscience on a different basis to evidence-based medicine, because there is no evidence base for saying, I'm not going to do an abortion, for example. So I just wanted you to say a bit more about that. Now, you may be right, you may be wrong, but I wanted you to be clear about why you're saying you think that special status should be accorded if it's not coming from evidence-based medicine.
Right. Okay, yeah.
I'm Gabriel Weston. I'm a surgeon, not a gynecologist. I think really why this is such an interesting subject is because conscientious objection affects the availability of services for women, which is obviously a really big problem. And I just wonder whether there are other reasons than conscientious objection why doctors might quite reasonably feel that they were really putting themselves into a hell of a situation by agreeing to do abortions, even if their politics are very pro-choice. It seems from my research that gynecologists suffer an enormous amount of alienation, even amongst their colleagues, when they're prepared to step forward and do this very difficult work. And I also wonder whether there isn't a sort of inherent ambiguity sometimes between the discourse of feminist pro-choice politics, which I certainly would absolutely agree with, and a sort of lack of stomach for the actual work itself. And so I just think that perhaps conscientious objection is the label that we're giving for other reasons why gynecologists might be finding it incredibly difficult to do this very courageous work. And I just really like it. I think it was really for Dr. Fiala I was thinking of that.
I think that's an interesting point, just to kind of throw out, because certainly the doctors that work for VPAS, many of them will feel, as I indicated, that they can't operate beyond a particular gestation. Now, they don't have a conscience. It's not like they're saying it's a conscience problem. And it may or may not be a technical problem, but it's just they just don't feel that they can do that step too far, which I think touches on what you're saying. Yeah, Nina. Here. Okay, you first and then you. Yeah.
In the last session I went to, it was on trust, and one of the questions that the chair put to the panellists was, when you go to the doctors, do you trust the doctor or do you Google it yourself after you've been to see the doctor? And, it is a big discussion, and, my mum's generation would trust absolutely what the doctor said, whereas this generation doesn't. And it got me thinking that actually one of the reasons why in the past we've trusted the doctor is because we built up through a collective understanding of what doctors needed in terms of training, a training that took 5 years, went to university, took 5 years, practiced, and out of that spewed a doctor that we all felt we could trust as human beings. One of the issues I think that this kind of opens up, which I think deals with, kind of raises a similar point, is that it becomes a bit corrosive, because you're sort of saying, you don't want the state to force people to do things that they don't want to do. Their conscience won't let them to do. And I do really agree with the point that was made about conscience being a very human thing. But then on the other hand, people being able to opt out whenever they feel like it becomes something that maybe does that start to corrode what it means to be a doctor representing a profession which is an institution that we as human beings in our society want to trust. I don't want to force doctors to do things that their conscience doesn't want them to do. But at the same time, I want people to be able to go to the doctor and trust that what the doctor's doing is for the best for the patient without Googling it afterwards and questioning, because I think that's very corrosive as well.
Thank you.
So the common thread that I hear is morality, and this dichotomy between having a reasoned, rational argument and a moral intuition or a moral emotion or just a bad feeling. So I know principally that I don't want to do this because I object because it feels wrong and it's bad. And I feel like we could maybe bridge the gap between rational thought and moral intuition. My problem with conscious objection is not the freedom to have that choice as a GP or as a gynecologist. My problem is that it allows us to rest on our moral laurels, if you will, and engage in moral laziness. So if conscious objection comes about as a product of rational, reasoned argument and discussion and honest debate, and then after that, a product of I don't want to do this is the result, then I'm okay with that. It's not okay, though, to just say, I feel bad about this, and principally I can object, and here I have now the means by which I can do that through conscious objection.
Yeah.
Thanks. Piers Ben. I think a lot of very different issues are being run together by the different speakers. And in fact, I disagree quite strongly with all the speakers on different issues, unfortunately. On the issue of conscience, the last speaker from Catholics and Pro-Choice talked about the role of conscience in the Catholic faith. I'm not a Catholic, so I'm not the expert at all. But I take it that from Aquinas, the understanding is that to act permissibly, two conditions have to be satisfied. One is that it should accord with your conscience, but crucially also your conscience has got to be right. It's got to be in accordance with God's law. The question about an erring conscience binding really raises the question, well, if somebody's conscience misleads him, why is that? Well, if the answer is because he never had sufficient chance to know the truth, he'd never heard of the Christian message, that's one thing. That exonerates him to some extent from blame. If that's not the answer, then it's more difficult. Which leads to the question, when you said, I forget your name, the last speaker, a doctor has to respect the conscience or the view of a patient. Well, that's what the GMC says, but what it means is something different. It means accepting, listening to, tolerating. It doesn't mean doing whatever the patient wants you to do, just because the patient's conscience says okay. If a doctor thinks abortion's murder, then of course in conscience I can't see how he would agree to that. Which leads to the issue of referral and complicity. If you really do think abortion's murder, as is the view of the Catholic Church, you're hardly going to say, well, I don't do murder myself, but that doctor down the corridor, he does murder, go to him. Of course you can't say that. In conscience, you're going to have to refuse any involvement altogether. That's the only consistent position. Which leads just very briefly to the first speaker about should there be a right of conscientious objection in the medical profession? The answer's got to be, it depends. If, say, a Jehovah's Witness surgeon, we always talk about patients, but say a surgeon says, I don't do blood transfusions, I'm a Jehovah's Witness, well, his future in the medical profession is far from assured, and quite rightly so. When it comes to things like abortion, it's difficult. My own inclination is to say, so long as there are enough other doctors or other provisions willing to do this, and by the way, this is independent of the question of the ethics of abortion, it has to be kept apart, then yes, there should be provision for conscientious objection, because the values of anti-abortion doctors are sufficiently similar to the values of civilized people in general for us to allow them, leeway and room for discussion and pluralism in medicine. The line is very difficult to draw. I don't know where to draw it. It's got to be there. So that's really my take on this.
Okay. Yeah, at the back.
I find it very tricky to try to work out my own position on this. But I wonder, is pragmatism in order here, and would pragmatism be a good thing? And what I'm thinking about is, if you look at the debate about religious schools, I mean, I support the right of parents to send their kids to religious schools and for the state to fund them. Because in Britain, about a third or a quarter of schools are like that. So it means when a Catholic school denies the right of a particular teacher to come and teach because they're not a Catholic, I have no problem with that. But if we lived in a country where 99% or 100% of the schools were Catholic, I would have a different position, because that means that those teachers who were not Catholic would have nowhere else to go. So, in other words, what you arrive at is almost a pragmatic consideration. If you transfer the logic that I'm trying to use on the faith schools debate to abortion, if in Britain we have enough gynecologists or doctors or medical professionals prepared to carry out the abortions, is it not the case that we should allow that exercise of conscience?
Okay, I'm going to take Sandy Starr, and then I'm afraid that's it. I'm sorry to those of you who I haven't been able to get. Yeah, him.
It's a quick point. I'm speaking at a session on reproductive choice later this afternoon. I'm as pro-choice as they come, but I did have some problems, Christian, with your presentation. And if I could just focus them on a single point. I think you suggested there was a contradiction between conscientious objection and evidence-based medicine, but I really don't think there is. I don't think the counterposition of evidence-based medicine and faith-based medicine that you came up with is an accurate description. To me, faith-based medicine would be the belief that you can procure an abortion via prayer. Evidence-based medicine, people who don't want to perform an abortion know how an abortion works. They know the evidence for it. They simply do not want to do it. So, although I agree with some of what you said, I'd come at it from a very different angle.
Okay, we've had a load of points raised. I'm going to ask the speakers if they can come back in reverse order. So, ask DJ to kick off with. And I think perhaps one thing that didn't get picked up in the audience that you might just want to pick up in your summary is, again, this point about the difference between the individual conscience and an institutional conscience, because I think that's something that you feel very strongly about.
Sure. First off, in response to the Catholic questions, can I just assure everyone that the Catholic Church does not think that abortion is murder? In fact, no, it doesn't.
No,
Excuse me,
please.
When the Vatican was asked that specific question, they said, no, we don't know when the fetus becomes a person, so we can't say that it's murder. Individual bishops do say it's murder. A lot of individual Catholics say it's murder, but that's not actually what the Catholic teaching is. I think the question you raised over there really leads me to my summary around what a Jesuit priest said, is that conscience is being ruined by ideology, because people are, as you said, using conscience to opt out of providing services for a host of other reasons. It may be not a very well-paid job, it could be any number of reasons. And certainly the issue of the importance of conscience is being abused by those who are using it for other reasons. And I think also that the issue that Anne asked me about the institutional aspects of a conscience, are an example of that. Because, as I said, an institution cannot have a conscience. The people who run the institution can have a conscience. They cannot have a collective one. They can each have individual consciences. And I think it is unfair and illegitimate to say, therefore, that even though we all agree and we don't want to provide abortions in this hospital, that means that there is such a thing as an institutional conscience. I think to say that to argue that there is one is actually the antithesis of what a conscience is, because a conscience is something very internal, very individual, and it is something that that should not be violated, I feel. And I'm going to close, or near enough close, with a quote from who was a guy who was Cardinal John Henry Newman, who I believe the Pope recently beatified him and he became Saint Newman. And he argued, when he was asked about this very issue of conscience, he made a point that I think is very valid about the human nature of church teachings and the internal nature of conscience. He said, I shall drink to the Pope, if you please, still to conscience first and the Pope afterwards.
Well, there have been some very interesting comments, and it's not possible to go into it all in detail. The question that Ellie Lee raised about the special nature of medicine, my understanding of I do think that there is a sense in which medicine plays a special role in society, but it actually goes all the way back to the Hippocratic origins of medicine, where the idea was that the physician takes a covenant to act in the best interest of the patient, irrespective of their own interests, and secondly, not to use their skill to harm. And really the origin of the idea that trust me, I'm a doctor, really comes ultimately from that tradition. Now, within the tradition, there's always been the responsibility to act with professional competence, with skill in the art. And so recently that translates into evidence-based medicine, which of course I fully support. But that's really just a gloss, as I see it, on the fundamental idea of a prior moral commitment to act in the best interest of the patient. Now, it has been said, if I genuinely believe that what this person has come to ask me to do is actually to damage them, is not in their best interest, then to coerce me and force me to do something which I genuinely believe is not in their best interest is to damage my own moral integrity, as well as that seems to me, if it becomes known that doctors act according to the rules, that doctors are merely state apparatchiks, then this idea of trust me, I'm genuinely acting in your best interest, I'm not doing what the hospital says, I'm not doing what the state says, I'm doing what is best for you, that will only be defended and protected if we protect the right of conscientious objection, that special privilege. Now, it is a privilege, and I absolutely accept, as I said earlier on, that right of conscience is often being abused. And I think it is true that there are sociological pressures, there are all sorts of pressures which can force doctors to operate in ways which they feel profoundly they object to. I also agree that the conscience shouldn't just be some vague sort of feeling of unease, and that we do have a right to thoroughly and rationally debate and discuss and understand our own moral positions. I certainly wouldn't say that the conscience is just some kind of vague emotional response. Again, if just take the few psychiatrists who stood up against the political pressure because they said this is wrong to use electric shock treatment on political pressure. And that wasn't from some vague emotional response. That was from a carefully thought through understanding of what medicine was all about. So I want ultimately again to still say, yes, I understand there are problems about services, but and I also say that I have difficulty with the idea that an institution has a conscience. Ultimately, it seems to me that a conscience is something that resides in individuals. However, I can see that if a group of individuals, a private group of individuals, get together and say, we as a group discuss what we believe in, what our values are, and we as a group decide that we don't wish to do this, then I'm not sure that the state, again, has the right to coerce those individuals and say, you will provide those services. Now, obviously, there's a difference for a state service, and that raises all kinds of other issues. But I want to protect the right of individuals, including communities of individuals, to act in ways which are in accordance with their own moral purposes. Ultimately, again, I just want to reiterate my final point. This is a question of what kind of society we want to belong to. Do you want to belong to a society which respects individual moral integrity? And I think if you destroy that, then you will create a kind of society which ultimately we will not want to belong to.
Thank you very much. I would like to continue this question, or to take this question up. What kind of society do you want to live in? And I think that is really the crucial question. The question is, who decides over each of you? Is it ourselves, or is it the doctor who, under whatever excuse? I think that is the crucial question. Who decides? And is it the conscientious objection, the belief of the doctor that comes first, or is it your personal individual need and belief and conscience? I think this debate is really misleading. It is a pretext for a paternalistic behavior. And it implies that patients wouldn't have a conscience. It implies that it is only doctors who have the kind of a duty to impose their conscience on patients. And I'm very happy that we have overcome that medieval social concept, and that we came to a concept where individuals got the right and the technology to question and decide for themselves what is in their best interest. And I would just like to make the analogy which was mentioned before, blood transfusion during surgery. Blood transfusion is needed, is an integral part of being a surgeon. If you refuse to give blood transfusions out of your belief, you're just not mentally not capable to become a surgeon. You may be another good doctor in whatever different field, but you're mentally not apt to act as a surgeon. In the same way, unwanted pregnancies are an integral part of obstetrics and gynecology. You cannot just say, I want to become a surgeon, be in a powerful position, in a position where I can decide over other people, and be blind on half of your patients, those patients who have an unwanted pregnancy. If you have that belief, and you have all the right to have that belief, but then your patients can expect that you sort out that belief before you get into this position, before you get a gynecologist. And once you are a gynecologist, you have survived the severe competition to become a gynecologist. I think you have the moral obligation and the ethical obligation to serve in the best interests of your patients. And there is no way then to listen to your patients, to learn what is in the best interest of the patients, to pretend that you know better what is in the interest of your patients, is just showing that you are still living in a past world where paternalistic behavior of doctors was normal. And I think this reference to state obligations, especially electric shock, just is totally off the topic, and it shows to which extent how dangerous it is not to listen to the patients, because these patients who suffered from electric shock, not a single one of them decided to have it out of their own desire. They were forced to do to this treatment. So I think there is really no alternative than to listen to the patients for us as doctors, and to do what is in the best patient's interest and decided by the patients. If we have a difficulty, whatever, to do that, personally, for example, I have a problem to do beauty operations. But no one forces me to learn that kind of operation and to become a surgeon for beauty operations. I choose to become a gynecologist and obstetrician because I'm committed to wanted and to help women in wanted and unwanted pregnancies. And it is not upon me to decide to choose to pick those patients I prefer. And actually, conscientious objection is not at all a moral behavior, it is a moralistic behavior, and I think we need to make that distinction very clear in the public debate. Thank you very much.
Thanks very much to all the speakers. One of the things that I thought was really telling that came out of this discussion, and maybe this is a quality of some of the discussions at the Battle of Ideas, is that it sort of reflected to me that on all sides of this discussion, there's a sense of the need for people to act on decisions about what's right and what's wrong, and that actually, whether or not you regard it as a matter of conscience or you regard it as a matter of value, there's a lot of discussion about whether what people are doing is the right thing for the people that they're treating. The reason why I feel that this is important is because I think that very often conscientious objection is often seen as being a way of removing oneself from providing reproductive healthcare services. And what I feel very strongly from BPAS, from my organisation, is that our doctors provide reproductive health services because, as a matter of conscience, they think it's the right thing for them to do. So we have had many discussions in our organisation at particular times about whether we should continue to provide abortion up to the legal time limit of 24 weeks. And our doctors and nursing staff do so because they believe that it is right for them to do it. Similarly, as an organisation, we've always felt that it would be wrong for us to be involved, for example, in the compulsory treatment of anyone, regardless of whether the law says that it's right or not. Under no circumstances would we be forcing women into treatment, whether it's with contraception or whether it's abortion that they didn't really want to opt into doing. So I think organisations can have values even if they don't have conscience. And sometimes conscience can be about what you provide as much as it can be about what you withdraw from. A lovely quote, though, from an old book on conscience that I picked up from, in fact, an old C of E professor, which is that conscience is what makes man a man. It's what's, and presumably, conscience is what makes a woman a woman. It's what separates us out from the rest of animal kind, and I think there's something in that. We're thinking and we act in a particular way. Thank you very much for coming. Enjoy the next session. Thank you.